Hi everyone, welcome to my channel. I hope you're keeping well, and I thought I should also talk to you about mental health in my channel since I'm also a counseling and psychotherapy student. Your mental health, your psychological, emotional, and social well being affects every area of your life. Having a positive mental health allows you to effectively deal with daily life stresses, communicate well with others, make healthy decisions, and live life to the fullest. Maintaining your mental health is vital in living a happy and healthy life. But unfortunately, millions of people struggle with mental illness, which leaves them helpless, hopeless, and alone. Today, I'm going to talk to you about depression. Depression is one of the most common mental health conditions affecting more than 264 million people worldwide. A sense of hopelessness, a feeling of being weighed down, and loss of enjoyment in things which used to bring you joy. These are some of the common signs of depression, one of the most widespread mental health conditions around the world. Clinical depression goes by many names, such as the blues, biological or clinical depression, or major depressive disorder, which is MDD. Simple things like getting dressed in the morning or eating at your mealtime can feel like large obstacles when you have depression. Depression symptoms take many forms, and no two people's experiences are exactly alike. A person with depression may not always seem sad to others, and when friends or family notices symptoms of depression, they may want to help but they do not know how. Clinical depression is different from sadness or grief, like when you lose a loved one or experience a relationship breakup or you get laid off from work. It usually consumes you in your day-to-day living. Like sadness or grief, depression doesn't end in a day or two. It continues for weeks, interfering in your work, school, or relationship with others, and your ability to enjoy life. So if you think you have depression or you know someone who has depression, I would advise you to meet a mental health professional such as a psychiatrist, psychologist, or a social clinical worker who can diagnose your condition. Even though a general practitioner or family doctor can make an initial diagnosis, a specialist can provide a complete follow-up treatment. Some of the common symptoms of depression are a persistent feeling of loneliness or sadness, a lack of energy, feeling of hopelessness, getting too much or too little sleep, eating too much or too little, feeling unworthy or guilty, difficulty in concentrating, lack of interest in enjoyable activities or socializing, and thoughts of death or suicide. If you are experiencing these symptoms every day over 2 or more weeks, then you might meet the criteria for depression diagnosis. Depression can appear differently in children than in adults. Some of the symptoms in children include anxiety or anxious behavior. While MDD is the main diagnosis of depression, there are also other kinds of depression. Each form of depression has its own symptoms. What is major depressive disorder or MDD? If you experience a loss of pleasure in activities that you used to enjoy, along with a depressed mood that lasts at least for 2 weeks, then you might meet the criteria for MDD. MDD in children and teens can look more like irritability rather than sadness. What is postpartum depression? Postpartum depression is depression that can occur on people who have just given birth. Typically, postpartum depression can begin in the first month after giving birth. It can also begin during your pregnancy. If you have a history of depression, then you are most likely to experience postpartum depression. What is seasonal affective disorder? Seasonal affective disorder is a subtype of depression that is triggered by seasonal changes. Though it's very common in winter and fall, it occurs in summer as well. If you find a persistent sadness or lack of energy in a certain time of the year, you might be having seasonal depression. What is persistent depressive disorder? Persistent depressive disorder, or PDD, previously known as chronic depression, is a form of depression that lasts for at least 2 years. While it can be challenging to treat than other depression, it's possible to get relief from the symptoms. If you are diagnosed with PDD, your healthcare professional will work with you to create a treatment plan that's best suited for you. What is bipolar disorder depression? Some forms of bipolar disorder involves depressive episodes. Sometimes depressive episodes alternate with mania or hypomania. Treatment for bipolar disorder depression can be different from other treatment approaches. Other subtypes of depression are anxious, melancholic, psychotic, catatonic, and atypical. If you talk with your therapist, you can learn if any of these applies to you. As with most mental conditions, researchers are still unsure what causes depression, but some experts consider genetics, gut bacteria, family background, personality, environment, and social factors contribute to depression. According to NIHM, other risk factors for depression include a family history of mood disorder, major life change, trauma or chronic stress, certain medical conditions, or alcohol or other substance use. If you ask, can depression be successfully treated? The short answer is yes. According to NIHM and the countless research studies over the past 6 decades, depression can be readily treated with psychotherapy, talk therapy, or antidepressant medications. Psychotherapy approaches scientifically proven to work with depression are cognitive behavioral therapy, that is CBT, interpersonal therapy, and psychodynamic therapy. Psychotherapy is one of the most effective way to deal with any kind of depression, and it has very few side effects. For mild depression, many people begin with self-help strategies such as emotional support, exercise, and diet. Research also indicates some herbal remedies such as St. John's wort and saffron can help relieve depressive symptoms. Even though it could be difficult to maintain self-help strategies when you experience a depressive episode, small steps can help. Antidepressants such as selective serotonin reuptake inhibitors are the most common prescribed medications for depression. If psychotherapy and antidepressant doesn't work, your clinician may consider other treatment options. Now we are going to see what we can do to help someone who is with depression. First is listen to them. Depression can be an isolating experience for some. So the best thing you can do is let them know that they are not alone and that you're open to what they want to share. Don't try to fix their problem, give advice, or judge their feelings. If they can fix it, they would have done it already. So the best thing you can do is listen to them. Second is help them find support. When someone with depression decides to seek help, it can be an overwhelming experience for them. There are so much of doctors, psychiatrists, psychologists, helplines, and so much more. So you can ease their burden by helping them to look up for support. Third, offer to help with tasks. For someone who's living with depression, even small tasks like brushing their teeth or cleaning up the kitchen may drain them emotionally. For this reason, offering to help them with something seemingly small can make a huge difference in their day. Lastly, I want to tell you recovery from depression can take time, but there is hope. There are many steps that you can take to manage depression. And always remember you are not alone. And if you want to talk to someone, always resources are available and you can talk to them right away. One more important thing, if you know someone who's talking about suicide, you can call the National Suicide Prevention Lifeline 24 hours a day at 800-273-8255. You can also find a helpline in your country with befrienders worldwide. I hope it was helpful. For more interesting topics, subscribe to my channel and don't forget to share it with others. Bye.